Hello everyone, hope all of you doing good. Today's presentation is about the routine eye examination and eye examination room setting. That means what are the most basic and common eye examination procedures what we do when a patient comes for an optometric or an eye examination, and how do we arrange an eye examination room settings, what we have to be careful about in very general manner. So the first thing, if anyone comes in for an eye test, the first thing that we look for ocular history. We want to know about their eyes, we want to know about what happened with their vision and how is their general health. So that will basically give an overall idea about the eye, the vision, what kind of vision corrections they are using, if they have any general health problems that would probably affect the eyes. So all those things we need to collect, and we generally used to keep it in a record or in an electronic format or in a case file kind of arrangement. And the next we end up with checking their visual acuity. Visual acuity is the most common test that we need to do in every single visit for a patient. So it's very important to have the visual acuity tested both for distance and near, and then if they're using glasses or contact lenses, we need to check it with glasses and without glasses. So to make a complete visual acuity assessment and keep it recorded, it's very important when the patient is coming next time, we need to have this previous visual acuity to compare what happens with the vision, if the vision is stable, if he has come with an eye problem, and if he has got a treatment. And the next visit we need to check the vision just to see if his vision has improved or not, if you have given them a glasses, if that glasses is again improving vision or not. So visual acuity is the most important one and to be done in every single visit. Next thing is about the extraocular motility or the muscle movement. Okay, how are we going to go ahead with the muscle movement, because we need to just make sure that all the extraocular muscles are perfectly working and that makes the eyes move comfortably. So that extraocular muscle movement testing is also an important one. Probably you might not have to do that in every test or every visit unless you are suspecting any problem with regard to the muscle or with regard to the alignment of the eye. So for example, if there are squint or squint treatment goes on, so those are the cases which you will have to repeat in every visit. But otherwise, once if you have done and tested for once, you can keep it on the record. Next comes the refraction, another most important one, because we need to know what is the refractive status of the eye. If there is any refractive error or not. If there is a refractive error, what is a refractive error, whether it is a myopic or a hyperopic or combination of myopia or hyperopia with astigmatism or anything, and whatever be the glasses that you're going to prescribe to the patient, okay, or what will be the glass prescription. All these things comes in refraction. That means the objective refraction to find out what is the refractive status of the eye, and then you do subjective refraction to give him the best possible glass power or correction. So we usually call it as best corrected visual acuity. Moving to next, pupil evaluation, and this is something which we have to do, and most of the time we do not see people do that, but this is a very, very important test, okay, just to make sure that the eyes nerves are working well. To be very specific, it will give you information about the optic nerve and as well as the oculomotor nerve. Okay, so when we do the pupil evaluation, we basically shine the light and then we observe that the pupil that receives the light get constricted, and then that clearly tells that if a pupil gets constricted, the light is taken to the brain, right, or the information has gone to the brain, and the brain has asked the pupil to constrict through the oculomotor nerve. So that is a very broad explanation of the pupil evaluation. It is a little bit more extensive one. We probably will discuss it in some other presentation as a single presentation. So pupil evaluation, it's important. It gives a clear idea about the optic nerve and the oculomotor nerve. Then comes your slit lamp examination. Okay, this will give you an overall idea about how the eye structures are structurally or anatomically functioning. So it helps to examine till the back side of the lens or till the anterior side of the vitreous. And this is also a very important test, because this will give you a clear idea about the cornea, the iris, okay, the crystalline lens, and the sclera conjunctiva on every structures in a magnified manner. We also need to do the tonometry. Okay, in whichever type of tonometers you use, you may use a Goldmann appellation tonometer, or you may use a non-contact tonometers, or any other tonometers that is available in your clinic. But tonometry is very important for everyone. Okay, those who are youngsters, those who do not have any family history of glaucoma, you might not have to do it every visit, but people above 40 years or 40 years and above, you will have to do the intraocular pressure measurement in every visits, because that is the time people might show the possibilities of glaucoma, even if they do not have any family history. Now, ophthalmoscopy, it's a way to check the retina, and it depends upon what the ophthalmoscope you are using in your clinic. So someone will be able to use a fundus camera. That means a non-mydriatic fundus camera. You do not really have to do an ophthalmoscopy. The idea is try to look into the retina. Okay, you can use a direct ophthalmoscope, you can use a fundus biomicroscopy with the help of slit lamp, a 90D lens or a 78D lens, or if we are confident in doing indirect ophthalmoscopy, yes, by all means. Okay, so but in whichever means it is, okay, direct ophthalmoscope will be a much better option and easier option in regular clinical setting. You can easily look at the macula and the optic disc. Okay, definitely if you are suspecting something in the peripheral retinas, you will have to request them to go for a dilated examination. So ophthalmoscope. So that completes the basic tests what we do in a clinical setting. Now next we'll quickly look at what are the things we need to be generally aware of. I'm not going into the specifics of it in a detail. Generally what we have to be aware of when we are testing or when we are selecting a room for eye examination. One is a room size, the eye examination room size. Generally we look for a room that is slightly longer than 6 meters, but not exactly 6 meters. If we are using a visual acuity chart that can be used at 6 meters, we use a room size of 6 meters. And not everywhere you will have the luxury to select a room that is 6 meters long or sufficiently broader. You can still use a 4 meter room, okay, where you can optically fold. Okay, what I mean optically fold is you can use a mirror, okay, so that you can easily convert that distance, okay, the half of the distance into full distance. So as you can see in this picture, this room is 3.5 meters plus 3.5 meters, that is a 7 meter room. So how we can make this room equivalent to so when we're keeping this mirror here, okay, even if it is a 3.5 room, you can make it as a 7 meter room. So that will give you sufficient space to keep this distance away for the patient. Okay, if you want to adjust a chair a little bit, all these things are possible. So if you look at from the patient eye to the visual acuity chart here, right, so effectively it will be here, okay, but when you're using a mirror, the visual acuity chart is kept here at the back of the patient's head, and you keep the mirror here and you make the patient sit here. So if this distance is 3.5 meters, you can make this distance 2.5 meter, so effectively the distance becomes 3.5 plus 2.5, that means 6 meters. So this is, you do this kind of mirror arrangement if you're using a visual acuity chart that is designed to test the visual acuity at 6 meters. You can have visual acuity chart that can be used to test the visual acuity at 3 meters. So if you have a 3 meter chart, you do not really have to use the mirror. Okay, and you can also get visual acuity chart that can be used at 4 meters. So at 4 meters, again, you might not really have to. If you have a 4 or 4.5 meter room, then you can easily use a 4 meter chart. Now you can use this kind of this kind of digital display visual acuity charts are very commonly available. The advantage is you can actually control, you can actually select at what distance you need to keep it. So depending upon your room size, you can select the measurements, or you can select the letter types or octave types on the visual acuity charts. So that is also very convenient to consider, but make sure that you choose appropriate visual acuity chart, whether it is a 6 meter chart, 3 meter chart, or 4 meter chart. Accordingly you arrange your room. Now another general thing what we have to be careful about is the room lighting. Okay, we should not be using a very bright room, or you should not be using a very dim room or a dark room when you're testing for the visual, when you're using for eye examination. We generally use somewhere in between, that is a dim room. Okay, so what is the impact of that, especially when you're doing the visual acuity testing? If you are using a room that is extremely bright, what will generally happen is automatically the pupil size of the pupil gets reduced, and it will basically give an effect of a pinhole. So sometimes even if you have a patient with refractive error, he might read more than his actual visual potential is, because of the pupil is very small. He gets an effect of the pinhole, all the peripheral aberrations will be taken out, and you will see an overestimation of the visual acuity. On the other hand, if you use a very dark room, the opposite happens. The pupil gets dilated, and the size of the pupil becomes broader or bigger than the normal lighting conditions. So in that time what happens is the visual acuity gets underestimated. Okay, or you get an effect of night myopia. Night myopia is nothing but the eye's accommodative system changes and accommodates towards the near when the ambient illumination or the illumination or the light that comes into the eye becomes lesser. So that is what you have to be careful. If the pupil gets broader, your visual acuity testing gets underestimated. So we do not want either case. We want somewhere in between, where the pupil is in a regular room lighting conditions. So those are the things what we have to be careful about when we are looking for, or when we are trying to arrange your eye examination room. So next, a quick look at what are the basic instruments we need when we are doing an eye examination. So we already have discussed it. We need a visual acuity chart, we need a trial set. Okay, trial set, it could be a phoropter if you have, but we need those lenses for refraction. And we have, of course, need your retinoscope and an ophthalmoscope. A direct ophthalmoscope would comfortably do. And if you can afford, okay, get a slit lamp, and you do not really have to pay so much for a slit lamp. Okay, you can get slit lamps of so many different ranges available in the market, but when you're considering for an optometry practice, you really need to have a slit lamp as well, so that you can make all your eye examinations perfect. So that's all. I hope you broadly got an idea about what are the common tests what we do in an optometry practice, and what are the minimum set of instruments that we need to have for a proper eye examination. Okay, so that completes this presentation. I'll come back to you with some other presentation very soon.